I'm more than happy to start a new video podcast episode today with a very special issue and with very special guests. Guests from New York City, a city that is very hardly affected by this pandemic, and a city that's maybe the most harmed city so far in the world. And there are elected officials, there are authorities dealing with it, but each and everybody, businesses and each and every single person has to deal with the issue as everywhere in the world, also in this very special city, New York City. I'm more than happy that Alessandra Biaggi is with us. She is state senator. She has been elected last year, actually, to the state senate of the state of New York. And I'm more than happy that you are with us, Alessandra, today in this video podcast, as well as Stephen Judson. Stephen Judson is a businessman. He's a communication strategist, and he has been a friend for years already. I guess the first time we met in New York City must have been 2012, I would guess, something like that. And I'm more than happy that both of you have the time to talk to us today and to provide us with an authentic view on the true situation in NYC, and also with the perspective of political level of the officials who deal with this, as well as with the perspective of businesses. Alessandra, let's start right away with the state of play regarding the corona outbreak in New York City in terms of facts and figures. It changes every day. It changes every day all over the world. But what's the specific situation in New York City right now?
Sure. So first I wanted to say I'm very grateful to be able to share this with you and with all of your followers. And I'm grateful to you for still convening all of us in community regardless of the circumstances. So every day, and I'm sure that everyone's following along, the numbers in New York City and the state of play is really going up. As of today, April 6th, which really are the numbers from yesterday, because at the end of every day is when we get the updated numbers. So as of today, April 6th, which are the numbers from April 5th, the confirmed cases in New York, in the United States are 365,525. In New York State, which has about 19.6 million people, we have about 130,689 cases. I represent two counties, Bronx County and Westchester County. In Westchester County, where really the epicenter of the coronavirus began in New Rochelle, a small little city right next to the district that I represent. In Westchester County, we have 14,294 cases. In New York City, we have 72,181 cases. And in the Bronx, which is one of the 5 boroughs, we have 13,680 cases. In terms of hospitalizations, in New York State, we have 16,837 cases. 4,504 are in the ICU. So that is, of course, it means that those are the most serious of cases. Of those who have been discharged, we have 13,366, which is a promising number. And in terms of deaths across the United States, we've had about 10,925, although we do expect that that will spike because the coronavirus has still not hit other places as hard yet as it has hit Washington State and New York State. And then in New York State, in terms of deaths, we have about 4,758. The most important thing that we're trying to do, or at least one of the most important things, is testing. New York State has really done everything it can to pop up these testing sites. And to date, we have conducted statewide 320,811 tests. So as many people probably know, as a result of all of those numbers and the seriousness with which New York has been hit, similar to other cities, New York State is doing something which is called a stay-at-home order. So most people are at home if they can be. If they're not essential workers, they're home. And they are remaining in place. And it's under a program that the governor called New York State on Pause.
Alessandra, thank you for these insights. Colleague in European Parliament from Germany is a medical doctor, and he always says the true number is the number of fatalities, the number of the victims of the death. So what about that number in New York City so far, and how is the development of that number?
So the number in New York City is in the thousands, and there's different contributing factors as to why. So when we think about New York City as a whole, there's about 8 million people who live in New York City. And I think that there's contributing factors as to why the virus has spread so quickly in New York City. But I think it's really important to remember one thing. And I think we're seeing this across the entire world. The ways in which the government reacts and responds and plans for situations like this plays probably perhaps the greatest role in terms of the number of deaths or cases that we see. When you compare the United States to places like South Korea, what we're seeing is disproportionate numbers. In South Korea, as soon as they learned that there was even one case and were able to contribute it back to patient 0 or patient 1, as they've called it, they halted basically all of life. In New York City, it took a lot longer. And many of us, like myself and others who represent New York City, were very, very frustrated because we knew that one of the only ways to stop this and prevent this was to make sure that people actually stayed in place. The total number of deaths in New York City is 2,738. So it's a very large number. We expect it to go up, unfortunately. But because people are really staying at home, we think that over time, as we keep hearing, the curve will actually flatten out. We just don't know when.
Thank you for also making remarks on this very historical moment we live in. And it means a lot to the world and also to the United States. Before I pass to Stephen Judson, Alessandra, let me ask, you already mentioned your constituency. You represent Westchester and the Bronx, the 34th district, as far as I know. So generally speaking, what parts of society, what parts of population are most affected by the sickness on the one side, and what businesses are most affected in your constituency or generally in NYC?
So what we have seen right here in New York City, as well as Westchester County, which is a suburb right outside of the city, is complete devastation of our small businesses. Many of our small businesses that are not able to make rent or able to make their monthly or weekly quota have closed their doors. What you'll see is that a lot of food or restaurant distributors or wholesale distributors of food are still in business because they're bringing the food to the supermarkets. Our supermarkets have been completely wiped out when it comes to food. That's made it very challenging for a lot of people who are hourly workers to be able to come off of their shift if they're essential workers and to be able to shop. But a lot of our small businesses have closed their doors, which is something that we're going to have to really rebuild. Now, in the United States, we've created and provided a lot of different loans and grant programs. But as you know, Lucas, of anybody, it's very hard for people to navigate the government and to the government space. And so my team has really been pushed to overdrive when it comes to helping people in the community as well as small businesses. Now, when we talk about the person or type of individual who is most affected, and we've heard this many, many times, the vulnerable population. Who is the vulnerable population? The vulnerable population are those individuals who have underlying conditions or what they're calling comorbidities. And I'm sure Stephen will talk about this as well. Things like asthma, diabetes, heart disease, lung disease. Now, I have to say, Bronx County as a whole has the worst health outcomes in the entire state of New York. There are 62 counties in the state of New York, and the Bronx is 62. What does that mean? It means that what is expected in the Bronx is for not only the highest number of cases, but the highest number of deaths. In the South Bronx, which I represent, it has some of the highest cases of asthma in the entire United States. And so this creates now a perfect storm of not only individuals who don't have access to healthcare or hospitalizations or testing sites, because many of them don't have cars, and a lot of our testing sites are actually drive-through, but it means that unfortunately they're the most at risk. So we've been doing everything that we can to fight for them, to be the voice for them, and just really to make sure that they have the information, because at the end of the day, having the information that will keep them safe could be one of the differences between staying alive or not, going to the hospital or not, keeping their family safe or not.
But your constituents have you in office, and that's something important, and it will help to overcome the crisis. I'm sure we met in an Albanian coffee shop more than a year ago. I've heard it's also closed at the moment, but it will reopen hopefully. And you didn't know in advance, but it's the case that I'm pretty close to Albanians and Kosovo people in Europe. And that's why I will never forget this Albanian coffee shop in the Bronx. Stephen, I'm more than happy that you're also with us today. Businessman, communication strategist, but also a human being, as all of us. And as far as I understand, and that's what I want to start with, because everybody has to get a sense of the truth about the sickness, that it affects everybody and everybody is touched by it, that one of your family members, an aunt from you, is affected by the crisis. How is it going?
Yes, actually, my only aunt, she was diagnosed on Thursday of last week with COVID-19. She's 83 years old, and she presented at the hospital on Cape Cod, where she lives in Massachusetts, with pneumonia in her right lung. Happily, she's like a lot of we immigrants, is very tough. So she's insistent that she'll be out soon, and the doctors are optimistic. So thank you very much.
Yeah, I include her in my prayers, and my best wishes are with her and with your family. Well, how has your life in NYC, your daily life, changed since the outbreak?
Well, that's an interesting question. So my life revolves, like many people, around their families and their work. In my case, my work involves 4 very different businesses: the communications business, the real estate business, the classical music business, and the art business. And I have 4 companies. So the primary concern for me when this started to take shape in my mind as an issue was how do I safeguard those that are important to me? So that's my family and the people that work in our offices. So as I think I mentioned before to you, Lucas, before we started the interview, one of my staff in the consulting business is a China scholar. And he brought to my attention the danger of the outbreak in China back in early January. And at that point in time, we were sort of bemused that he would bring this to us, but he was very strident in his prediction, which sadly turns out to have been accurate. So about 6 weeks ago, we started distancing, and we sent people in that company home to work remotely. What I see here is a dramatic drop in people out and about, which is a good thing. We have, I don't know, Alessandra, if you would agree with this, but I think that we are very fortunate to have a very strong and practical governor who has sent largely the right messages to the citizenry of New York State. And that, I think, probably has averted something that could have been even worse than what effectively is a catastrophe for our state. I have concerned myself with plotting how to provide my staff with continuity. It's very important to me. I have some highly paid staff, and I have a lot of staff that fall squarely in the middle income and some in the lower middle income of society. And those members of our community are most likely to have an adverse result if they lose their jobs, which makes me think of what Alessandra said earlier when she spoke of the high incidence of the disease in the South Bronx. The South Bronx, of course, for many years, a little less than it was when I was a kid, was a very poor neighborhood. And these diseases, this disease and others like it, disproportionately attack those with less opportunity to get to the doctor, less opportunity to shield themselves. They don't have a country house in the Hamptons. And this, of course, underscores some of the deficiencies in our society in this country. And it's fortunate that many of our legislators in the Democratic Party, and other members of government have identified the issue and have taken swift action to safeguard, to the extent that it's possible, those at-risk populations.
Thank you for sharing this, I would say, frank view on the situation in the United States, which we all love for many different reasons. But of course, maybe there is something lacking, as we can see today, but that's not my business. Part of my business is to keep an overview, and that's why even here in Europe, I watch CNN nearly every day. And that's why I also got a very clear impression on Andrew Cuomo's work, the work of the governor. And I'm pretty impressed on how he is dealing with the crisis. He seems to be a great leader, actually, in these times. That's also my impression. So thank you for making that point. Now, may I ask you, Stephen, your customers, your business partners, your various sectors of the 4 parts of your business you mentioned, how are they affected now during the crisis? Do things stand still? Are things more affected and others less? Or how can we understand the situation?
Well, I'll inventory them through the businesses. So we own an art shipping and storage materials company. So museums, galleries, private collectors buy our materials to transport their art to different parts of the world. Craters and shippers buy our metal parts to make crates. So that business has seen a drop of 95% in its revenue in the last 2 weeks. So, and that comes directly from the public authorities in those states that have taken this seriously in the US, directing that all museums and large public gatherings cease. Which then brings me to my music business. I own a classical music concert management business, and we represent some very famous orchestras and musicians for performance and recording and television. In our business, the model is we negotiate 1 or 2 years in advance of a performance to make a contract for our clients. The performance then happens 1 or 2 years later, and at that point in time, the night of the performance, the performer is paid, and we are paid our fee from his or her fee. Every performance that we planned 2 years ago that was on the books for March, April, May, and June was canceled. So that's nearly 100 performances. And a company like ours has only revenue in this regard, although we provide management services advising on taxes, accounting, immigration, visas, programs, and other overarching management functions. The revenue comes from live performance. So that business has gone from a revenue which was moderately profitable to 0 revenue. So, and then we move on to the communications business. The communications business remarkably has seen an uptick in its business because we advise a number of very large European multinationals on their communications. What are the issues of the day that they really need to address, and how do they address those issues? And we write white papers for them and help them communicate. So that business remarkably is in quite good condition. And then finally, there's the real estate business, which really, more than the other two, is really core to the essence of everything that the 3 of us are talking about. As a landlord, we own buildings on Madison Avenue and Lexington Avenue on the Upper East Side, which is a very Tony zip code, very affluent community. I have 3 restaurant tenants. All of them, of course, were directed to shut by government order, which is understandable. Of the 3, 1 of them has gone out of business permanently and surrendered the keys. The other 2 have asked for relief. We have given relief, significant relief on the rent. And in some cases, we've deferred rent for 6 or 8 months. My attitude is these are longtime clients of ours. Our success doesn't come from the fact that we're fortunate enough to own the buildings. Our success comes from the tenants. And then the residential tenants are also having trouble. So I get probably 80% of our tenants in our buildings and the commercial tenants have called me in the last 3 weeks asking for relief. Some have been very direct about what they want. Others didn't know what to ask. Others were embarrassed. And my standard response is, tell me what your trouble is. Tell me where you're having the most problems. Let me tell you what I'm going to do. And it's generally with a cash accommodation. So we're cutting your rent in half. We're forgiving your rent. We're deferring it for 6 months. And it's curious because we, of course, have seen our revenue drop by 70% in the real estate business. So I petitioned my landlord. We've been a tenant for 19 years in this building. And the building manager didn't respond to several emails. And the owner, when I wrote making a concrete proposal and rationalizing why we were asking for this, didn't respond. So I think, I mean, that's unfortunate, but we'll be fine. But most people aren't going to survive this unless they get a lot of help from their colleagues, their landlords, their friends, and the public.
So true. Lucas, can I respond one moment to what Stephen said? Is that all right? So, you just touched on so many important points that my brain was just like churning with all the different ideas and the things that are happening. And I want to start with this because this is really on point with kind of how the conversation just went. So today, I'm in the state of New York today in Wisconsin. There is currently an election going on. The governor of Wisconsin said, let's postpone the elections in person because of COVID-19.
And the court decided differently.
Yeah, they overruled it. So if you see the images right now, if you turn on CNN, you see the images of people, hundreds, if not thousands of people outside, which is rule number one not to do during a pandemic, in lines down the street. Really just, it's both inspiring, and I mean this sincerely, it's inspiring because, wow, people are still showing up to vote regardless. And it's also devastating because I know that of those people who've come outside, a lot of them probably will become infected with COVID-19. Now you go to the business side, and Stephen, it is not surprising to me, and also very humbling to hear that you as a landlord have been so gracious and so kind to the people who are renting from you. And that's exactly what we're hoping for. The legislature right now is pushing to solidify and to put into law real accommodations for renters so that people don't become homeless and don't lose their homes. Because if we have a surge in homelessness right now, that will also contribute to this pandemic growing. On the commercial rent side, the governor has issued, as you know, a commercial moratorium on rent. What does it mean? It means that you have about 90 days to not pay rent. And then tenants, commercial or residential, have 90 days where they will not be evicted. Now, the problem here is exactly what you said. You hit it right on the head. A lot of people don't have the information. They don't know even what to ask for. And so this is where my job becomes really challenging because, and I'm sure, Lucas, you probably feel the same way. I don't have a magic button that I can push to talk to all the people that I represent. I wish I did. If I did, I'd be talking into it all day long to tell them all of the updates, but I don't have that. And so we do a nightly email update, which we have gotten really incredible feedback on because we're aggregating all the data.
I receive it day by day, even if you're not, I'm not one of your constituents, I receive it, and I'm happy to receive all the information from NYC.
I'm so glad to hear that, truly, because here's what's been happening. People have been forwarding it, and information right now is key to this. We have to make sure that the most vulnerable populations have it, but also that all New Yorkers and all citizens and all non-citizens have it, because that's the point here, that we're breaking down that barrier and really caring for all people. So Stephen, I'm so appreciative of what you're doing.
Thank you, Alessandra, for mentioning the Wisconsin election, because it's really a mistake, in my view, to hold this election today. And it's a risk. It's a risk to health and to security. Even North Macedonia, if you were talking about the Balkans before Albania and Kosovo, North Macedonia actually postponed its election due to the crisis. It would take place on April 12th, this Sunday, but they postponed it, and this would be the right decision. We have a saying in Europe that's the crisis shows the character. The crisis tells about the character, and that's something that applies to what we have heard from Stephen as a landlord today. Alessandra, let's move to the response in the state of New York or even the city of New York? Who is doing what in terms of medical doctors, police, all the others? What's the role of volunteers as well in NYC?
So, I mean, last week the governor really made a plea for all retired nurses and doctors who were able to please come forward. We have seen tens of thousands of retired nurses, doctors, EMS workers, police officers, FDNY and firefighters come forward to step up to help. So we have seen an outpouring of support from those individuals. On the front lines, we have nurses, we have doctors, of course, we have EMS, police, we have a lot of different health practitioners doing whatever they can, both in the hospitals and outside of the hospitals. Now, in the hospitals, as predicted and as we see on television, of course, and are learning in the news every day, our emergency rooms have become really the central place where people are coming, even though we're advising people to stay home if they have if they have symptoms that are not serious, because we don't want to overwhelm our hospital system. Before COVID-19, remember I said there's 19.6 million New Yorkers. We only had 3,600 ICU beds. Post now, or during, I should say, because we're not beyond this yet. In the crisis right now, we've added 1,000 beds on, as you've seen probably, on a ship, a federal ship that has come into New York Harbor. We've pushed hospitals to the limits when it comes to adding 100 beds, 200 beds, 300 beds, opening up floors that were previously closed, erecting tents in the outside parking lots, opening up hospitals in Central Park, in Van Cortlandt Park in my district, and other parks around New York City, and then also thinking about how we can take the most sick and bring them to places where they can be in isolation from others. So we have seen a surge in that, unfortunately, because of a problem that is really pervasive and really does stem from the federal level of our government, specifically our president, who has not chosen to fully enact what's called the Defense Production Act. We have seen a real shortage of PPE, which is personal protective equipment. So when you don't have enough masks or gloves or gowns to treat and take care of patients, you yourself become sick. So in my district, we've seen several deaths, if not 5, at least 10 of nurses. We've seen doctors and nurses who don't want to go home at the end of the day, who are sleeping inside of their cars because they don't know what they have on their clothes and don't want to come home to their families and infect their families with potentially COVID-19. And so that's one aspect of it. We've also seen really just an overworking, I would say, not only of the hospital system, but of the people who are inside of it. Nurses who are doing 48-hour shifts, doctors who are following form as well. We're seeing a real pull on the reserve of residents. So residents who might have had, X amount of time left, maybe a year or two to complete their residency, are now being pulled into the front lines because we need all hands on deck. Now, here's something that is actually, it's heartbreaking. There are other nurse practitioners and doctors and medical experts in other states who have put up their hand to say, I want to come and help New York State, but are not doing so because of the shortage of PPE, personal protective equipment. And so this is also contributing to really why I think our nurses and doctors are being pushed to their limits and practically exhausted beyond measure. And so we're doing everything we can at the state level, to help to get these masks and these PPEs. There has been probably more people than I have ever seen put up their hand to say, I will sew masks. I will contact, if I'm a fashion designer, I will contact my production line in China and I will have them produce them. I will put a plane together and I will put my own personal money. I will raise money in the community to feed the doctors and nurses and those who are in need. I will raise money in the community to fill our food pantries with food. I mean, the range of what people are offering right now is inspiring, but you have to go back to what we started with, which is that the doctors and the nurses and the EMS who, in the beginning of this crisis, now you mentioned Governor Cuomo, he has been a very steady hand here. And I have not always agreed with a lot of his policies, but I am very grateful to be in New York State right now because he is a very strong voice. He is a very strong leader at this moment. And he makes me feel safer. And I know that he makes all New Yorkers right now feel safer. Now, the city, New York City, with our mayor, took a little bit longer to shut down than I think that many people had wanted. And that perhaps could be one of the reasons why our numbers have spiked so high. But the governor has come in, he has been clear, he has had plans, and his number one priority has been to keep people safe. And so just yesterday, what we saw was that what he did through an executive order was say that, if people are congregating and they're not actually practicing social distancing, they not only will be fined, but the fine will now be increased from $500 to $1,000. Now, many people listening to this might say that's really harsh, but really why he's doing that is because the severity of this disease and how quickly it can affect not only the vulnerable populations that we discussed, but also those who are young are also getting infected and very sick, is very serious. And so we're trying our best to make sure that everybody has, again, information, but the protective equipment.
That's very special about this crisis, that we need on the one side leadership, but there's also a responsibility with each and every single person. That's why fines, like you have mentioned, we also have this in our country, are important. Alessandra, for our understanding in Europe, what level of government has what obligation at the moment during this crisis? What's the obligation of the federal level, of the state level, maybe of the local levels? What is done by civil society communities, businesses, and initiatives like you have mentioned? All the people you have mentioned in the front line, nurses, doctors, and the others are, of course, the true heroes of our time. But what's the structure like? How can we understand it in Europe? How should things work, and how do they work actually?
This is such an exciting question because there's so many different things happening right now. Okay, so if we're talking about the pre-pandemic, right? The pandemic has not happened. The role of the federal government, and this was the case under President Obama, was to have a pandemic team, right? That's studying the current trends of what's possible, what type of pandemics are happening or epidemics are happening in certain areas, what viruses are popping up that the United States should be aware of, that scientists should start to study, that we should create vaccines for. Unfortunately, in early 2017, under the Trump administration, the pandemic team was dismantled. The entire office where this information and this type of work would be done was defunded, which means that when we came to this 2020 pandemic, we didn't have a team ready in place at the federal level to deal with this. And so when you look at the United States and the response, the federal level's number one response is to be the central command for guidance to all 50 states. Now, like in Europe, right, we have different regions around the country, except we are a United States, which means that the federal government, while there are governors of each state, the federal government is the place where the states get a lot of their guidance from. Unfortunately, what we have seen is a lack of that. And so what has that meant? It's meant that every single governor across the entire United States has had to take their own action individually of the President of the United States and the federal government, and really take leadership here because it's unprecedented. There's no playbook to look to see, do we shut down a city? Do we shut down a state? Is that the right thing to do? They've had to really use their advisors and their own knowledge to do it. So in the state of New York, we've seen swift action. When we compare it to a state like Florida, the governor has still only just recently is starting to close things down. But if you look at South Carolina, the governor there just reopened, I believe, the beaches yesterday. I mean, just crazy inconsistencies where in normal times, or if there is such a thing, or under an administration at the federal level that had planned for this, you would see more cohesiveness. So the federal level is supposed to do that. There's also something called the federal stockpile of supplies. So I just mentioned PPE, which is personal protective equipment. Under ordinary circumstances, that stockpile would be a place where we would.
California is helping out the NYC right now?
That's correct. So you have states helping out other states, California and Washington State, I believe Oregon too, or actually Oregon and California sending ventilators because the governor of New York said we need ventilators. So you see other states doing that. But there's something else that we're seeing that is actually a little bit frightening. So when it comes to PPE, personal protective equipment, again, there is a shortage of this. Because the president has not enacted or put into place in its fullest capacity the Defense Production Act, masks that usually would be upwards of 60 to 80 cents, very cheap per mask, are now $7. So you're seeing almost like a Hunger Games between the states who are outbidding each other when it comes to trying to get these supplies. And you're also not only seeing that, you're seeing New York the other day lost one of its orders to FEMA, which is the Federal Emergency Management Agency, which doesn't even make any sense, because now you have government competing against each other, and you also have other countries like Spain and Germany competing to get all the supplies in the United States to try to bring it back to, of course, Spain and Germany and other countries, and rightfully so. But the problem is that there hasn't been a central command, and so that would have been a thing that would have benefited all of us. At the state level, what we're doing and what we have done is we've passed multiple laws for paid sick leave. I'm sure many people know we don't have paid sick leave across the country. It's not a common policy. So at the state level, we passed 2 weeks of paid sick leave, regardless of what type of job you have, to make sure that you can actually get benefits. Unemployment insurance has really been provided in a way that's never been provided before by removing.
Let me ask you, who is paying for the paid sick leave?
So
is public money, or is the employer obliged to pay?
Public money. It's public money. So the state of New York is paying for this. And, and that's a really perfect segue, actually, because the state of New York pre-COVID-19 had a $6.1 billion deficit. Last week, we passed the state budget. It was a very, very challenging set of decisions to make. I voted no on one of the bills that was aimed at cutting money to our hospitals during a pandemic. Now that's a conversation probably for a whole other day. But the point is that the money's coming from the state, and what we're projecting post-COVID is at least $20 billion in state deficit. Now, we've also had federal aid passed through the Congress. So hopefully the states will be provided with billions of dollars worth of aid. We don't know when that money's coming. And so we're not really waiting around to do something or act. We're going to provide the services that people need now through unemployment insurance, paid sick leave, loans to different businesses, and so on and so forth.
Thank you for that. Stephen, thank you for your patience, by the way, but it's so interesting to listen to Alessandra. What's your assessment on the response on the different levels of government and elected officials in your country and in your cities especially?
Well, that's an interesting question, and Alessandra, of course, covered a lot of very valid and important points. I think there's some fundamental issues in this country. As a New Yorker, as a lifelong New Yorker, and I suppose Alessandra will share this view, I'm deeply embarrassed that a guy from Queens, as President of the United States, is behaving the way he's behaving. And what we see are mixed messages coming out of the White House. President Trump has some of the finest experts in the world, Anthony Fauci, Dr. Birx, the staff at the CDC, and yet when they make a recommendation, as recently they did, to wear masks, he comes out and says, well, you should do that, it's optional, but I'm not going to wear a mask. And so many people who are supportive of the president take that to mean that this is not really a serious situation. The mask is not indicated, I'm not going to wear one. Now, the issues of price gouging that Alessandra mentioned on the masks and other equipment, that's a sign that cynicism, regrettably, is alive and well in our country. The Wisconsin legislature's depriving the governor of deferring the elections is a profound act of cynicism that will cost human life unnecessarily. And when I look at the Congress and the Senate of the United States, you see something that we've really never seen before. The polarization and the antithetical ideologies of the Republican and Democratic Party are on full display right now. I think back to September 11th, that image of President Bush at the time in the kindergarten class reading a book. And the Secret Service come up to him, or somebody comes up to him, tells him what's happened, and he sort of doesn't really understand it. And projected sort of a weak face. But very quickly, and the Senate and the Congress were pretty polarized at the time. Democrats and the Republicans really weren't getting along back then when September 11th occurred. But you saw immediately, Bush rallied the cabinet, the Senate and the Congress immediately aligned, discarding partisan politics, and the president and the government activated the military. In New York City, we had sorties of 4 F-15s flying every 3 minutes over the city to safeguard our airspace. We had the Navy on high alert in all positions of the earth. We had the Army on the streets here and in other parts of the country safeguarding the Pentagon, Washington, and places of importance for our command and control structure. And the public felt, as I did, and I'm sure most other Americans did, this was a terrible thing. We're stunned and shocked. It's a new vocabulary in barbarism that an airplane could be used to knock down a building, killing thousands. But our government is protecting us. The military is out there. Nothing, they may have gotten us once, but they're never getting us again. This is not the case in this crisis. The president has gone between calling it a political hoax by his enemies to deprive of him a second term, to influencing governors not to act. And I think what we see is we've seen a failure of government on certain levels of the government. So our well-constructed federal, state, and local system has been hampered by the executive's inability to move past a personal narrative of the president. So then I come back to the state response here in New York, which I know best as a New Yorker and what I see with my own eyes. The governor, the state legislature, on a lot of levels, both sides of the political aisle, the Republicans and the Democrats, have understood immediately that now is the time for all New Yorkers to move beyond their personal preferences, their personal discomforts, and come to the aid of their fellow New Yorkers. And that's why members of the Senate, like Alessandra, are so vital to people like me being able to resume our happy lives, making the money we did, seeing the friends we did, going into the restaurants of our clients and seeing happy faces and people not worried about breathing. It's a very circuitous answer to your very straightforward question. I'm sorry it took so long.
Thank you, Stephen. Thanks to both of you. I love to talk to you, and what you share with us is really meaningful in both of your cases. I'm more than happy to talk. I just want to add one final question to both of you, since we are running out of time, which seems important to me, as we all need also a sense of optimism in these times. What's your prediction on the one side for health issues and on the other side for labor market and business economy issues? Maybe we begin with Stephen with this final round, and of course please share whatever you feel important to convey to Europeans, but especially your prediction for the coming up weeks, but also for generally the new world order, some people say, ahead.
So my message to my European friends, and I have a lot of them and have a lot of love for the homeland of my antecedents and ancestors. We are stronger than this. And notwithstanding the conflicting messages that come from Washington that you in Austria shouldn't have any masks because 3M, which is an American company, makes them, so the president's not going to let you have them. That's not the way most Americans feel. We're concerned as citizens of the world. And it will take much more than COVID-19 to defeat Americans, Europeans, Africans, Asians, and people from Australia and New Zealand. We will certainly triumph over this. It may take a while longer, but we will come back to the days that we remember. Some things might change, but nothing will fundamentally change our ability to live happily in our societies, worshiping where we choose to, having the friends we wish to have, and seeing our children grow up, marry, and have their children.
Thank you, Stephen. Alessandra, what's your prediction? And may I ask you for your message?
Sure. So I think that this is a once in 100, if not 500-year opportunity to transform the way that we live, to transform the way that we think, and to transform the way that we show up. I have family in Northern Italy who, as soon as this started to happen, the first thing that came to mind was, what can we do in New York or the United States to help Italy? And it's the same sentiment across the entire world that we're seeing. What can we do here to help our other sisters and brothers and friends and neighbors and family members or strangers, really, in other places? It's highlighting the gaps in our system that really need to be fixed, which is, I think, a good thing. But it's also proving that we are all one world. And so I think that at the end of this, if we allow it, if we show up for it, if we're brave enough to respond to its calling, we will have transformed the way that this world moves forward in a more beautiful way, in a more united way, in a more loving way, and really just be able to profoundly affect the future lives of all of us.
I really like the attitude of both of you. You mentioned opportunity, Alessandra. I also guess the world, in some regard, grows together by this pandemic because it affects all the world. Hopefully, all of us learn the lesson of this pandemic, and hopefully we overcome the peak of the crisis as soon as we can and as soon as possible. Alessandra mentioned before that information is key today in your constituency, in my constituency, all over the world, I assume. This video podcast provides a lot of information, I guess, and that's what I am grateful to you for. Thank you so much for your time, for sharing. I wish all the best to you, your families, your beloved ones, your friends, to New York City, the city as well as the state of New York and the whole United States. And actually, we all have to wish the best for the whole world during this pandemic. Thank you for your time, and I hope to see you soon again in person in Europe, in the United States, or wherever in this world. Thank you so much.
Thank you so much for having me.